Yeah, so Nancy Gilbert is our speaker for this session. So I'm just going to introduce Nancy briefly. Nancy's a lawyer by profession, formerly the manager for Appropriate Technology Enabled Development Programme for PIND, which is an NGO in the Niger Delta of Nigeria. She's got a doctorate from the Royal Roads University researching sustainable sanitation in the Niger Delta and riverine communities. So Nancy practiced law for 8 years in Canada, 2 years in New Brunswick before starting an advertising agency with her husband. Since then, she worked in marketing, communications and brand strategy consulting until settling into her real passion, which is WASH development. So having joined Rotary back in '94, Nancy served as district governor of the Rotary District 7, 8, 10 during 2003 to 2004. And she was the inaugural Rotary coordinator for Zone 24 East back in 2008. And she's also served as a member of the WASH-RAG board. Nancy lives with her husband in Victoria, British Columbia, Canada, and have a blended family of 7 children and 9 grandchildren. So without further ado, I will hand over to Nancy, and we will dive into this first of our breakout sessions. Okay, Nancy, over to you.
Thank you, Sonia. And I should just clarify that I am co-presenting with Daniel Narenda. I haven't actually looked in the program, but I'm assuming Daniel's bio is there. But Daniel's a member of the WASH Club as well. We both are, as is Sonia and Bruce. We're kind of dominating this session, I think. And Henrik as well, who's just joined us. And he also runs an NGO in northern Malawi called Rural Development Partners. And Daniel and I have been working together for many years on different issues, but most recently, along with Brima Apambere, who's doing a breakout session in another room right now, we've been working on a program in northern Malawi to build sustainability of WASH systems in healthcare facilities. So today, this session is maternal and child health, but what we're going to focus on is WASH in healthcare facilities because that is so relevant to maternal and child health, and share some basics about WASH in healthcare facilities. And then we're going to talk about the research that we've been doing, the program that we've been doing, and some of the things we've been learning on the way through. So I'm going to start by sharing my screen, and tell me if you're just seeing one slide or the whole thing, or what do you guys see there? Should I put it into presentation mode, or is that okay?
We can see the whole thing, Nancy, but perhaps you could put it into presentation
mode.
mode. That might be better, but if not,
I got to just move the bar around so I can access. Hang on. There we go. All right. So is that okay now?
That's perfect.
Very good.
Perfect. All right. So WASH in healthcare facilities. What are we talking about? I mean, obviously sustainable water, sanitation and hygiene infrastructure, resources, services and practices in a healthcare setting. So that could be a hospital, it could be a clinic, whatever is involved. And we're talking about water that can be accessed either by pipe or hand pump, but we're talking about adequate quantity and quality of water suitable for a healthcare facility. We're talking about sanitation facilities as we normally would, toilets and latrines, but also healthcare waste management. So sharps and infectious waste. And even with latrines, think about what might be in poop if you're in a hospital and dealing with sick people. And on the hygiene front, the concept of hygiene expands to not just personal menstrual and hand hygiene, but also infection prevention and control. Environmental cleaning is really a big area, and equipment processing. And so that's like cleaning equipment, but also sometimes running equipment. There's such a diversity of WASH needs in a healthcare facility. You've got a huge diversity of users, people moving through the facility, so they change. Different from a community or a school where you're more likely to have a more stable group of participants. Many of those users are going to be vulnerable, not, obviously dealing with illness, that's why they're there, those kinds of things. But when you're talking about WASH and healthcare facilities, there are additional challenges because you're bridging two systems. It's not just the WASH system you have to worry about, but you have to collaborate and coordinate with the health system. And there are some big movements in the health system, like the movement towards universal health coverage. We talk about health system strengthening, focus on quality of care and quality improvement, and obviously IPC, infection prevention and control. So these are really critical aspects of the health system that we work with and bridge across when we're talking about WASH and healthcare facilities. So in 2019, the Joint Monitoring Report on WASH and healthcare facilities provided the first global estimates for the new SDG indicators and found that 1 in 4, 24% of healthcare facilities lack basic water services. 1 in 5, so 21%, had no sanitation service, and 1 in 6, 16%, had no hygiene services, meaning they lacked hand hygiene at points of care, as well as soap and water at toilets. So globally, just 58% of healthcare facilities had hand hygiene facilities, water and soap or hand sanitizer at points of care. There wasn't sufficient data to generate global estimates for basic waste management services, and only 4 countries had sufficient data on environmental cleaning services. In least developed countries, just 1 in 4 healthcare facilities had systems for safe segregation, treatment, and disposal of infectious healthcare waste. So, I mean, you can really begin to get a sense of the scope of the problem and the challenge that we're facing, and how, you know, WASH is so critically connected to health. When you look at the basic chain of infection, I mean, you've got some kind of infectious agent, it's hosted somehow, the reservoir, assume it's in a person, it can be shared. And certainly during COVID time, we've all had a lot of exposure and experience to how things get spread around. But you've got a mode of transmission, a port of entry, and then a susceptible host who gets sick as a result. And when you think about that and think about the activities in a healthcare facility that would enable that, I mean, obviously hand washing is critical. You've got medical procedures where you may have to clean wounds or irrigate tissue, but obviously, you know, keeping medical procedures clean and safe is critically important. Patient hygiene and bathing, and here we have mothers and newborns, but other patients as well, obviously. Drinking water, including water needed for oral medications. Water's needed to disinfect and sterilize medical equipment. For use of many medical devices. Clearly sanitation is important. People continue to need toilets and need to have their waste managed and to keep waste separate from other people. Environmental hygiene, cleaning floors, cleaning surfaces, big opportunity to spread disease there. Disposal of hazardous waste, and then of course laboratory activities. So these are all areas where WASH is critical in a healthcare setup. So when you go back to this chain of infection, and you can see adding on kind of the increased vulnerability or needs in a healthcare facility, there are huge issues and huge opportunities for WASH to make a really significant difference. And if you look at how WASH, continuing on this theme, impacts health, I mean, you have to look at the functionality of WASH, the quality of the WASH infrastructure, accessibility. I mean, disabled people go to healthcare facilities as well. We've seen lots of examples of pregnant women, you know, come in to give birth, they're 9 months pregnant, and they can't fit through the door of the toilet, or they can't manage to squat down because there's no bar, there's nothing to help them, and it makes it very difficult. And then of course, the quantity is an important issue because you have to have enough facilities to meet the needs. And similarly, you know, they're often dealing with water shortages, with water quality issues. They may not test water, they may not have access to testing facilities, so they don't even know whether the water is safe. environmental hygiene is really critical. And this picture, of garbage outside a healthcare facility is not all that uncommon. And then, of course, WASH-related behaviors. How do you encourage those and support them? So, beyond coverage, just infrastructure, you need to look at functionality, the quantity of the facilities, the quality of the facilities, the accessibility, how accessible are resources like soap and other essential supplies. We've talked about water shortages, water quality, et cetera, et cetera. So these are all really critical areas to look at when you're examining WASH in a healthcare facility. Also, the ratio of facilities and the location of facilities is really important. They say that hand washing stations should be within 5 meters of toilets, but that's pretty far away. And if you know anything about nudge theory, as an example, where you want to place things in a position that makes it easy for people, it nudges the behavior that you're looking for. Putting a hand washing station close to a toilet and also close to points of care is really important. And you may have heard during COVID reports that came out of the US about healthcare professionals in the US who weren't washing their hands adequately. I mean, behaviors are so difficult to change and then to really sustain. There was some data collected by Johns Hopkins University in Ethiopia, where they found there was a ratio of 71 nurses and midwives to 1 sink with soap and water. So you want to encourage these behaviors. It's crazy to be talking about that kind of ratio. Some of the benefits of WASH in healthcare facilities, I mean, clearly reducing healthcare acquired infections and antimicrobial resistance, AMR as it's called, is really important. And that affects both patients, but also staff, because, staff are susceptible to these diseases as well. Preventing disease outbreaks, and that's an issue even here. We hear about some pretty scary bugs in our hospitals, and it's true all over the world. Staff morale and performance can be impacted by WASH, just that ability to feel proud of your facility. People-centered care and the increased uptake of services. You can model good WASH for the community that healthcare facility employs, and that's an opportunity to show how to be effective both in terms of infrastructure but also behaviors. It impacts healthcare costs because truly in the end you're going to save money if you're able to reduce infection and have a better functioning WASH system. And more we hear about climate resilient WASH infrastructure. So keeping that in mind when you're creating a plan and improving facilities, I think is really important. So taking this back to maternal and child health, WASH provision is inadequate in many healthcare facilities in lower and middle income countries, and labor wards are no exception. Some pretty astounding stats. This is back from a 2010 study, but globally around 1 million of the 4.1 million maternal and neonatal deaths per year may relate to unhygienic birthing practices. And the maternal mortality ratio in the developing regions is significantly higher than in developed regions. And a big part of that is lack of WASH and how that affects infection prevention and control. 94% of all maternal deaths occur in low and lower middle income countries. And the connection between WASH and maternal and child health includes, the obvious, for example, a birth attendant washing their hands. And that connection has been documented as early as 1795, but it may include the less obvious. So, poor sanitation causing parasites, which in turn causes anemia or other, critically important diseases, listeria or schistosomiasis. All of these things increase complications in pregnant women and lead to poor maternal health outcomes. And we can tie this, of course, back to the SDGs, goal number 3, which is, the health and well-being, decreasing the number of deaths and illness, and the global maternal mortality ratio. And also to goal 6, which many of us know so well as our WASH SDG. But all of this led to a call to action by the UN Secretary General back in 2018. And the global call to action was for water, sanitation, hygiene, or WASH, in all healthcare facilities. I particularly like the last part of this one, that every healthcare facility has the necessary and functional WASH services and practices in order to provide essential quality health services for everyone, everywhere. But I like this line: a healthcare facility without such WASH services is not a healthcare facility. I think that's really true. So the global targets: at least 50% of all healthcare facilities globally and in each SDG region have basic WASH services by 2022, and 80% by 2025, with the ultimate aim of 100% by 2030. And they're seeking improvements to address inequities across geographics, so both rural and urban areas, and among primary, secondary, and tertiary facilities. I don't know if anybody has any questions about that. We can either do them now or wait till the end, but I'm going to pass it over to Dan, who's going to talk about our particular research program.
Hi, everyone, and thank you, Nancy, for the presentation. You did it justice, and thanks for the background. I'll go straight into talking about the project that we've started implementing in Rumpi now, and yeah, just share a little bit of some experiences, and also, you know, outlining how our culture and my experience has actually you know, helped with understanding some of these issues on the ground. So we're focusing much on sustainability, and the main reason we're focusing much on sustainability is that when we did the study in 2019, we found that most of the facilities actually have problems with you know, sustaining the facilities that they have at the healthcare facilities. So the issue of sustainability comes in very, very seriously. And I want to just talk about the definition here, and I'll read it as it is. So sustainability is about whether or not WASH services and good hygiene practices continue to work and deliver benefits over time. No time limit is set on those continued services, behavior changes, and outcomes. In other words, sustainability is about permanent beneficial change in WASH services and hygiene practices. So let me just go into a little bit of discussion on the research that we did in Rumpi. And you see those pictures are just showing some of the gaps that were found or identified in the facilities. You'd see that there's a lot of you know, breakdown in, you know, sanitation facilities. The plumbing is not in order. The waste management is not done by proper facilities, and so those are just some of the examples of the gaps that were found in Rumpi. So I'll go into discussing key findings that we found when we did the study in 2019. And those findings have been actually outlined based on the WASH domains that we focus on when we're looking at WASH in healthcare facilities. So the first domain is water. And as is always the case, in most facilities, there was lack of continuous water service from the safe water sources. And some didn't even have the safe water sources. And there was also inconsistent water treatment practices, and no water quality testing was observed in all the facilities, actually. The district itself does not even have a water testing lab, so you can see how huge the challenge is. And if you come to sanitation, there's poor accessibility. Toilets were far away from the points of care. And even if they were there, most of them were not accessible to people with disabilities, physical challenges, and all those kind of things. And there was lack of gender and staff for patient separation. So, all those issues bring confusion at the facility. There was no menstrual hygiene facilities available, and also available toilets, not always functional. So even though there were some toilets in most facilities, most of them were also not functional. In terms of hygiene, insufficient hand hygiene facilities, often far from toilets. Nancy was just talking about, the proximity, distance, and also ratios. All those came into play. And water or alcohol rub often available at points of care, but insufficient, and soap throughout the facilities. All those were issues that were found under hand hygiene. And then in terms of waste management, inconsistent segregation and disposal practices within healthcare facilities. So you'd find that, if you talk of the 3-bin method, where you have 3 bins that are used to segregate the waste, most of them would have maybe 2, or if they had 3, they're not properly labeled or not properly color coded. So it was difficult, to manage the waste properly. So actually, waste that is clinical or infectious would be mixed with, general waste. So it would be difficult in terms of managing the waste at the end of the day. And then lack of functional or environmentally safe incinerators. This is very common, and even in the cases where they have the incinerators, you'd find that they don't have the know-how in terms of how to use the incinerator, or they don't have the resources like fuel to use, to burn the waste in those incinerators. And also capacity around operations of incinerators, that's what I was just talking about. In terms of environmental cleaning, no cleaning guidelines, lack of training for cleaning staff, lack of accountability mechanism, and also cleaners' role not valued. You find that cleaners are given other roles like, registering people that are coming to the facility, etc., etc. In terms of factors influencing sustainability, there was a landscape also that was done just to tease out some of the factors influencing sustainability. And those 4 main items came up as key, and those are resources, staff capabilities, guidelines and documentation, and also political will. So political will was at both levels in terms of managers of the facility, and also the district council, or maybe also the DHO, the people that are in charge of the facilities at district level. So based on the findings, and I also want to say that there was a baseline that was done this year, before inception of the project, and the findings echoed what was found in 2019. So nothing much has changed from the study that was done in 2019. And you also agree with me that based on the findings and what I've shared, you'd see that there's a challenge, and we need to find an approach actually that would bridge water and health, that would build district capacity to provide ongoing training, to support facility managers to clarify roles and responsibilities, that is job descriptions, and also provide regular feedback on performance, provide timely and useful data. I think you all agree with me that data is very key in terms of interpreting some situations and also making decisions. So most of the facilities will need to come up with a way, and a way of actually recording data and providing it in terms of how it can be used, and to help with also decision making, and maintain and repair infrastructure quickly and in a cost-effective way. The last one is also help make people's jobs easier and not harder. So that challenge needs a solution. And after brainstorming and bumping heads, Nancy, Brimer, and their organizations came up with a suggestion or a solution that would adapt a circuit rider model and use it in a healthcare facility. So the health care facility has not used the circuit rider model as an approach, and so using it in Rumpi district in Malawi is the first time that it's going to be used. and it's been adapted in a certain way to suit the needs of the healthcare facilities. So just a brief background of the Circuit Rider program. Maybe let me just be quick and say Circuit Riders are qualified traveling technicians that would visit a number of communities providing support, and they would visit facilities like boreholes and water systems a couple of times in a year. And their approach is not to go there when the facility breaks down, but it's to ensure that they make regular visits and conduct preventive maintenance. So these are different from what would others call maybe technicians, or like the water monitoring assistants, or maybe there are some that are called area mechanics. Those would respond to a breakdown. So the Circuit Riders are not responding to a breakdown, but rather they're going there and conducting routine monitoring and preventive maintenance. They're also not only looking at a repair of facilities, but they're also providing technical and administrative support. So the way, the different thing about the approach in the healthcare facilities is that we have two types of Circuit Riders, and there's the technical Circuit Rider and also the quality of care Circuit Rider. So I'll explain a little bit later about how they've been or how they are going to operate. But in the meantime, let me just look at the scope of the Circuit Riders combined. So there's a wash system capacity building, and then under that, there'll be some trainings for healthcare staff on basic repairs, inspections and management of wash. They'll perform more technical repairs, coordinate larger overhauls, and conduct water quality testing. So some of these things I'm talking about, they've already been done. The trainings have been done, and so the Circuit Riders will be working on implementing those. And there's IPC and hygiene training. Under that, they'll be training healthcare facility staff and advisory committees on IPC and hygiene practices, ensure availability of guidelines and instructions. All those are things that we're working on to ensure that the facility staff have them, and also coaching on facility and human resource management. So there's, like I said, a number of trainings that have also been done under that. So there's like cleaning, all those trainings have been done, and people are ready to start implementing. And issues of monitoring and reporting, training healthcare staff on use of checklists and monitoring tools, and also compile and share data with the host organization. So on that one, we've also done the wash fit training, the Circuit Riders, the facility managers, and also the maintenance people from the facilities have been trained on the wash fit, and also the tools that are used in wash fit, so they know how to do an assessment of a facility using Android phones, and also uploading the data into the necessary apps. So I'll continue by sharing the details of how the Circuit Riders are operating. Like I said, that we've divided them into two. So we have two types of Circuit Riders. Unlike the Circuit Rider program that only has one type, this approach has been adapted to have two because of the needs of the healthcare facility. Because you need people that understand issues of quality of care very well, and also people that are technical. It was difficult to find one person that would wear all those hats. So that's why we have two types. And the first type is a technical Circuit Riders. And by definition, these are the ones that will be doing the inspection, maintenance, repair of water supply, infrastructure, latrines and toilets, waste management, infrastructure, and also do the water quality testing, and also train staff on basic maintenance. So you can see that their role is more of ensuring that the facilities or the wash structures or infrastructure are always functional all the time. And there's a quality of care Circuit Riders. These will be more into, the trainings in terms of how, staff can do the cleaning, hygiene, waste separation, and patient-centered care. They're also going to ensure that guidelines and instructions are available at the healthcare facilities, and also coach the healthcare facility managers and staff on workflow improvement. So these guys are, most of the quality of care Circuit Riders, already employees in different facilities, and they are responsible for WASH, and so they already have the knowledge, and this role will be critical and will be good for them because they'll add some more knowledge and will be responsible for helping other members of staff in the facilities. So I just want to go into a little bit of the culture in Malawi and how maybe all these are going to affect mothers and children. I think we're all aware that in African contexts, the mother takes the role of the caretaker, or the one who is responsible for health of the children and including the husband. So, you know, improving WASH in the healthcare facilities will actually offload some of the burdens that the women and children would actually encounter if the conditions of WASH in the healthcare facilities was not addressed. So if water was, so these are just a few examples of how the women and children, or mothers and children, will be affected. A few examples, otherwise it's not exhaustive, and there are a lot that would happen, but I just want to highlight a few things. So, for example, if if water was increased, access to water was increased, you'd find that there'll be a reduction in the burden of bringing water for delivery. Most mothers in the healthcare facilities in our communities, if the facility doesn't have potable water or clean water, it would be their responsibility to go and get the water. And in doing that, they'll either go themselves or the guardian will go. So you'd see, and most of them would walk long distances to get the water. So it's quite difficult for them. So if the increased access to water was achieved, reduced. And also the mothers will be given more time to work on other equally important activities. If they don't go to fetch water long distances, then they'll be doing other things. And there will not be any need of having 2 or 3 guardians, which is most of the times the case, because they go there to help also with other things that are not available at the facility. And if there is increased access to sanitation, the facility will be more user-friendly to the mothers and the children. Looking at issues of menstrual hygiene, you know, some mothers or some girls would not be happy to come to a facility that does not have, you know, a facility or a structure that will allow them to be free or to be comfortable to, you know, to use when they are menstruating. And most of the times, in most of the rural areas in Malawi, they use reusable pads. So they'll need actually an area where they can go and wash and also be comfortable. It will also encourage mothers and children to visit the healthcare facilities, because now they will be, you know, they know that the facilities are there. So apart from just going to escort other people, they might also be willing to go and, you know, ask for other services that they might not have asked for, because they know if they go there, they might not be comfortable to use the facility. It also reduces the burden of disposing medical waste. So in our country, you know, there's 2 issues: culture and also unavailability of the structures. So the culture, some of the mothers would say after birth, they'll get the placenta to dispose themselves, or the facility does not have a placenta pit or an incinerator that they can use to dispose of that. And then even if they didn't want, but the facility managers will force them to carry the placenta to their home to dispose of it. So if, you know, facility sanitation is increased, access to sanitation, and that includes also waste management, it means that these women will not have that burden of getting to dispose of their own placentas. Improved hygiene will actually prevent disease transmission. I think that was also highlighted by Nancy when she talked of antimicrobial resistance. And lastly, there is a promotion of gender equity and mainstreaming. You know, there are issues of women participation in most of the things. So like we said, that the healthcare facility is more or less of a demonstration center. If that is demonstrated at the facility, even the communities around are going to adopt those and also motivate women in the community that will start participating in other activities at community level. So that's just a little bit of how the project might help mothers or affect mothers and children. And I'll go into, I think that's pretty much of what we can say. And all that is being done with funding from the government of Canada, the Wallace Genetic Foundation, Rotary Club of Niagara on Lake Canada, Rotary Club of Mzuzu, and also FIT, that's Fund for Innovative and Transformation. So that is that. Thank you so much for your attention, and I'll hand over to Nancy to take questions. I'll also be around if there'll be some questions directly going to me. Thank you very much.
Thank you, Daniel. So we're open to questions. Sonia, are you gonna, do you want to moderate this part, or should we just have a look at the chat and in the Posner classroom?
Yeah, well, maybe we could start. I know there's a couple of questions in the chat. So if I'm looking correctly, the first one from Bruce. So do you want to pose your question to Nancy and Daniel, Bruce, or shall I just read that out?
Either way is fine.
Yeah, well, I'll read what you said. Maybe you add if there's anything else. But Bruce has asked, how do you think the cost of treatment affects the sustainability? Bruce says, from his experience in Tanzania, often at times the national health insurance fund payments barely cover medical materials and medical personnel, making it difficult to keep high wash standards. So the question is, how do you think the cost of treatment affects sustainability?
I think it's a great point, and it's always a challenge. There's never enough money, but how you spend the money matters. And I know Daniel's going to have an opinion about this and something to add, but in Rumphi District, which is where we did our research and where we're testing this program, the way it was set up was that the two larger hospitals' maintenance departments were responsible for maintaining all of the wash systems across the district. But somehow either they just never had time, or they didn't have budget. Like they never seemed to really get out to the other facilities. And when they did, it was on a reactive basis. So they would only go eventually when something was broken, which isn't actually the most economically efficient way, I think, to keep things running. So part of what the Circuit Rider program does is it turns that on its head and does two things: encourages the facility staff to do that routine maintenance. And I mean, I remember being in one facility and there was a tap that was running constantly because the washer was broken, and it had been doing that for ages, and they just sort of walked past it, but they had no idea how to diagnose the problem or fix it. And more complex problems, the Circuit Rider can fix when they're there and make sure that the maintenance is done so that they're less likely to break down. And one of the things that we're hoping to show through this program, I mean, you don't want to jump to conclusions, but one of the big questions we're asking is, does this make economic sense? I think, I'm assuming it does, but of course we have to gather the data and see what it costs to provide that training and preventative maintenance versus the benefits, which may be a challenge putting a dollar figure on, but the benefits of having wash systems that work well. Daniel, do you want to jump in and? Do we have Daniel? There he is.
Sorry, I'm available, but when the question was being asked, I actually lost connection, so I didn't get the question. Is it different from the one that is in the chat?
No, it's exactly what's in the chat, the first one from Bruce. Yeah.
Okay, can I deal with the second one on the wash fit?
Absolutely, or the first one if you have an opinion, because remember, you've talked a lot about how money always goes to curative, to drugs before it goes to preventative, and really maintaining wash systems is part of the preventative system.
Yeah, so on that one, I would say it's the same everywhere. You know, issues of prioritizing. It's just a matter of prioritizing. I think Bruce talked about Tanzania and the issue of you know, like lack of funds for even the curative part. So here in Malawi, in Rumphi in particular, most of the times the district hospital that is in charge of the other smaller hospitals will go for budgeting meeting. And then even if they prioritize wash improvements or maintenance or those things, even if they budget for those things, most of the times their action is different from what is on the budget. So they'll actually even get the money that is there for buying a pump for a facility and then use it for fuel to go and collect them, like pick up a pregnant woman. Or they'll use the funds and, conduct a meeting for themselves to, to plan for COVID, or they would use the funds for doing other things, unlike or not the actual thing that was budgeted for. So it also comes to political will. I think that's what we were talking about in terms of sustainability. That political will is also an issue. If the manager of the district does not want to prioritize all these things, they only look at curative, they'll actually even divert the funds that were even meant for the maintenance. So it's a common problem. And of course, it's different with person to person. It depends on who is in charge at that time. But most of the times, managers are doctors, medical doctors, and they're always thinking about, buy medication or do this. And they're always thinking about their facility, which is the hospital, disregarding the healthcare facilities that are under them. In terms of WashFit, we actually trained the circuit riders and also the facility managers to set up WashFit teams in the facilities. So these circuit riders are not the WashFit teams, but rather they'll go into the healthcare facilities and set up the teams there. So they were given a trainer of trainers training so that they can go and set up the WashFit teams in the facilities that are going to take up the WashFit methodology and implement it. So I think that's what I can say.
And just for others who might not be familiar with WashFit, WashFit is a program that the WHO developed to help facilities continuously improve. And it includes an assessment tool and then, a whole series of indicators and tools to help them address issues. And often they will do things that don't cost much money, but make a big difference. And Daniel, has probably witnessed that. It's also a good opportunity to mention that on November 4th and November 5th, WashRag is doing a webinar on WASH and healthcare facilities, specifically on tools and resources. And Maggie Montgomery from the WHO and Arabella Hayter from the WHO, who both worked on WashFit, are going to be presenting and talking about the WashFit tool and some of the other resources that the WHO has that would help Rotarians interested in WASH and healthcare facilities. So I encourage you to sign up and register for that. Other questions? Anybody in the room have a question? Yeah, there's a hand.
I'm Laurie Bowman. I'm from the Denver University Hills Rotary Club, and I'm just curious what the quality of care circuit rider program, if you have any preliminary thoughts about that, and who are the folks that actually are the QOC circuit riders?
Great question. Absolutely. So we really were trying to embed this knowledge in the existing system as much as we possibly could. So, and we worked collaboratively with the district government as we developed the program, which I think is a really important thing to emphasize, that we didn't come in, parachute in with this. We really tried to work with the local leadership and the people who knew what was going on the ground. So the quality of care circuit riders were selected from the environmental health department. They allocate 5 days a month for this particular work, and they get a stipend to do this work, but they also have their regular jobs as part of the health department doing preventative medicine work. So they're doing inoculations and education and those kinds of things. And it's been really interesting because we've done a series of trainings with them. We trained them on a TOT on cleaning and have given them some training materials that they in turn can use with the facilities. We've had a consultant from the WHO train them on the 5 moments and hand washing. And some really interesting things have come out of that. So for example, one of the things they said to us was they had witnessed clinicians who would maybe wash their hands every 5 patients, but they wouldn't every patient because the patients were offended if they washed their hands after they saw them. They viewed it as the clinician saying they were dirty. And it made us realize that, you know, this is a complex and wide-ranging kind of challenge, and that we not only have to train the circuit riders and they in turn have to train at the facilities, but we need to provide educational materials for the patients and the families too, so that they are a part of the solution. Anyway, does that help to answer your question?
Oh, absolutely. Thank you.
Any other questions? We only have another minute.
Yeah, we don't have long left, so any quick fire questions maybe now, and anything more maybe people could put in the chat for Nancy, Daniel to have a look at a bit later on.
I'm going to put my email in the chat if I can spell.
No, Michelle had asked about how to register for the WashFit seminar, but I think
it's go to the WashReg website. Yeah, go to the WashReg website
there as well. So that's great.
Oh, excellent. Thanks, Bruce. Yeah. Yeah, it's free. And it's the Thursday night at, I think it's 7 o'clock Eastern, and then being repeated Friday at, or maybe it's 8 o'clock Eastern, and being repeated Friday at 11 a.m. Eastern. And there's simultaneous translation as well.
Yeah, I've registered for that one. I'm looking forward to it, Nancy. It was a great presentation. Thanks everybody for joining.
Thank you. And I put my email in the chat. If anybody wants to connect with me or has further questions, I'm happy to try to answer them. Thanks, everybody.
Thank you. Thank you, everyone.
Thanks,
See you
Daniel.
back in the other room.
Thanks, Nancy.
Okay, see ya.
See you.